This year's World Population Day, 11th July, coincides with the Family Planning Summit, the second meeting of the FP 2020 Family Planning 2020 initiative, which aims to expand access to voluntary family planning to 120 million additional women by 2020. Sierra Leone will be one of the countries taking part in the summit. During a press briefing at the Ministry of Health and Sanitation, the Deputy Minister 1 of the Ministry of Health and Sanitation, Madam Madinna Rahman, committed government's effort towards the popularization of family planning facilities and use.
These commitments were Sierra Leone will strive to increase the contraceptive prevalence rate to 30% in 2020, as well as decrease unmet needs to 10% by 2020. Policy and political support will be provided for family planning. Government will ensure sustainable financing for family planning. Government will support expanded programs and service delivery for family planning. I am to inform you that significant progress has been made on all these commitments. Family planning is a human right, and the right of individuals to determine freely the size of their families was emphasized and expanded by the 1994 International Conference on Population and Development in Kallay.
Deputy Minister further disclosed the challenges envisaged in pursuit of this goal and how the government seeks to address them.
To provide the required family planning and SRH services, the government is supporting over 1,300 family planning clinics and has embarked on capacity building for family planning providers for both long and short acting methods. Government is working with partners to engage communities and sensitize them on family planning and girl-child education, which is critical to forestall early childbearing. Government is also working to address supply chain issues and ensure that required contraceptive commodities are available in all parts of the country, no matter how remote that area is.
Dr. Kim Dixon from Unfpa stated that modern contraceptive use has nearly doubled worldwide, but in Sierra Leone, the contraceptive prevalence rate is relatively low, which is even a marked improvement as compared to previous years.
In spite of efforts being made by government and partners, the contraceptive rate is still low, and the unmet need in the country is high. This unmet need in Sierra Leone is currently estimated at 25%. Therefore, meeting the unmet need for voluntary family planning will allow more women to be able to better plan their lives, invest in each child, and to generate an income. Meeting the need for family planning and pregnancy-related health care in developing regions will have a dramatic impact on the lives of millions of women and their families. However, far too many women and newborns still lack access to these essential services.
The 2017 Family Planning Summit will bring together leaders and advocates from around the world to commit to expanding access to modern forms of contraception to an additional 120 million women, with a special focus on the most marginalized and vulnerable. Reporting for Star, Kallay.